Good evening, coming to you live from the Straits Times newsroom with Haryanto Diman. I'm Olivia Quay.
The Covid-19 task force said today that vaccination for children below 12 years old should start early next year, after safety and efficacy aspects have been studied.
Also, according to Health Minister Ong Ye Kung, Singapore is studying the possibility of vaccine booster shots. He said the expert committee on COVID-19 vaccination is actively working on the booster program and studying the results from other countries which have started the booster exercise earlier before they finalize their recommendations.
There are two key things we need to find out and learn from the other countries that have started it before they finalize their recommendations. What are these two things? The first is the incidence of adverse reactions. Will it be as low as the first and second dose, or higher? And if it's higher, what are the steps that we can take to mitigate or remove the risk? That's number one. Number two, should we go for the same vaccine or a different vaccine? And we call it a homologous or heterologous strategy. And there is scientific basis to suggest a heterologous strategy may confer stronger protection. So the UK is implementing such a strategy, and we will be monitoring the outcome closely. And in Singapore too, we have not a small group, quite a sizable group of people who took the first shot of mRNA, found out that they are allergic to it, and therefore complete their vaccinations using Sinovac. So we too, the EC19, will be closely monitoring their immune response.
And while that's happening, Mr. Ong said one thing the committee is clear on and will recommend is to proceed with administering a third shot. This will be for people severely immunocompromised at the time of their first two doses.
It includes those who are on cancer treatment, immunosuppressive therapy, transplant patients, and end-stage kidney disease patients on dialysis.
Singapore is opening its borders to travellers from 4 countries under 2 schemes. The first is a new one called vaccinated travel lanes, which will unilaterally allow vaccinated travellers to enter quarantine-free, and this will start with Brunei and Germany.
The second scheme lifts border restrictions for all travel from Hong Kong and Macau.
The vaccinated travel lanes with Germany and Brunei mark a measured start to the resumption of air travel with an essential set of safeguards. We have chosen to start with these 2 countries based on overall risk and operational assessments. CAAS is working with all partners, including airlines, Changi Airport, and other government agencies, to gear up for the vaccinated travel lanes, including putting in place the required testing regime. This will allow all stakeholders to run in their processes, learn from the experience, make further enhancements before we consider possible extension of the scheme.
Well, let's first take a look at conditions for travel from Brunei and Germany. As the name suggests, travellers entering from the 2 countries under the vaccinated travel lanes must be fully vaccinated.
They must have remained in either country and/or Singapore in the last 21 days prior to their departure and must travel on non-stop designated flights.
Instead of serving quarantine, they must take several PCR tests, one before they depart, another when they land in Singapore, and also on the 3rd and 7th day of their stay here.
Only short-term visitors and long-term pass holders will need to apply for a pass under this scheme. Applications will open from September 1st for entry into Singapore on or after September 8th.
Meanwhile, restrictions for inbound travellers from Hong Kong and Macau will be lifted earlier from next Thursday, August 26th. This applies to short-term visitors regardless of their vaccination status and with travel history to both places in the last 21 days before departure. They can apply for an air travel pass with immediate effect.
They will undergo a PCR test upon arriving at Changi Airport and will be allowed to go about their activities here if their test result returns negative.
From 11:59 p.m. tomorrow night, Singapore citizens, PRs and long-term pass holders who have spent the last 21 consecutive days in Hong Kong or Macau and coming back to Singapore will similarly take a PCR test upon arrival, and if the result is negative, they can go about their activities. This is in lieu of an SHN.
As for the Singapore-Hong Kong travel bubble, Transport Minister S. Iswaran said the government is unable to launch a sustained arrangement in its present form.
Well, let's bring in infectious diseases specialist Dr. Liang Honam from the Rofi Clinic. Welcome back to the show, Doc. So as Singapore reopens borders to travellers from the 4 places that we mentioned, Brunei, Germany, Hong Kong and Macau, are these conditions robust enough to keep our imported cases in check? For instance, if someone spends time in, let's say, a higher risk parts of Asia or Europe before departing for Singapore from any of these 4 places, do you think the conditions still ensure safe travel?
Great question. If you think about it, anyone can try to beat the system. You will try to find loopholes, fly through another country, in fact, lie your way to come into Singapore. And those will be the scenarios and those are the possibilities. It goes down to the immigration to actually check and make sure that these people truly qualify for the 21-day stay in Hong Kong or Germany or Macau before this. However, we shouldn't rely on that, and that shouldn't be the last line of defense. And the last line of defense is actually the vaccinations. If you look at the numbers of cases there are, which are unlinked every day, we are doing about 15 to 19 cases in the last few days, and that's becoming 1/3 to half of all the cases there are. And that's becoming the new normal. And which means if the person were to come into Singapore, he's at risk of passing it on to other people. But I wouldn't be worried if I'm vaccinated, because this is going to be a pandemic of the unvaccinated. Those unvaccinated will be at risk and they could end up with serious complications. So it boils down to the same messaging again. We really need to test, we need to identify them and vaccinate. And when we vaccinate, we try to clear the people. And consistently, if you've been vaccinated, you're going to end up with very, very mild illnesses, and it converts it into a common cold. And when people get common colds, they still travel. Not that I encourage them, but they still travel and life goes on as normal. That's what we are aiming for.
Dr. Leong, we also learned that the expert committee on COVID-19 vaccination is looking at booster shots. What are your thoughts on boosters and how effective will they be in fighting off COVID-19 and its variants?
We are always worried about the immunocompromised host. And Rianto, I write a question thinking about the weak amongst us. What we are worried about is when you actually give the vaccine, do you have the adequate response? And the data coming out from Israel as well as from US is that they don't have enough antibody response, and in turn they may be prone to infections. Now, the test which we do, or that's commonly available in Singapore, measures only the B cell arm of it, which is just one form of immunity. Now, in addition, there is another T cell arm of it that's not freely available as testing. And so far, it does seem that there is some response to it. So coming back to your question, I like the idea of boosting because it will give us a sense that these persons will be able to cope with the infections. As the country opens up as what they planned, all these people are going to get at risk of getting infections. And I want to keep as many of them out of the hospitals as possible. Now, even if the boosting doesn't work, okay, for the individuals who are infected, even if the boosting doesn't work, it doesn't mean that you are set for trouble, because you still have the T cell arm of it. The B cell arm may not be there, but the T cell arm is there. And number 2, you still have your mask, which you can do. And wear your mask properly, keep your numbers, and keep the people around you all vaccinated. The risk of you getting severe infection is still going to be lowered.
Right. Well, Doc, I want to talk about something that wasn't mentioned in today's press conference. MOH confirmed another fatality last night, the 9th death this month. Deaths in the US have also spiked. So, Doc, does it point to COVID-19 becoming more deadly?
Great question. The answer is no, I don't think so. You see, we are seeing a lot more cases. We're seeing a lot of cases now in COVID-19. But if you look at it, our age profile, the people who are getting it, is very different from the times when we had the foreign worker dormitory problem about a year ago. We are talking about individuals who are much older with multiple comorbidities. And if you look at the medical history, ischemic heart disease, hypertension, hyperlipidemia, stroke diseases, all the diseases of the matured and too much of a good lifestyle. So these people, unfortunately, are at risk of getting COVID, severe infections. It could be a severe infection from influenza. It could be a severe infection from COVID-19. And they are predisposed to this infection. And I think the best data to tell you that Delta strain is not worse off comes from Iceland. If you remember Iceland, they had a very, very good vaccination drive at the very beginning of the last year, and practically everyone was vaccinated. And when Delta strain enters Iceland, they're getting a lot of cases. But the number of hospitalizations have remained low, the death rates have remained low, which means their strategy, which is very similar to our strategy of vaccinating, actually works. Vaccination prevents the severe form. And number two, that the Delta strain is not worse. Vaccination takes the teeth out of the bite and makes it into a harmless bark.
Well, thank you so much, Dr. Leong, for your perspectives there. We always appreciate your time and insights. We've been speaking with Dr. Liang Honam, an infectious diseases specialist from the Wilfie Clinic at Mount Elizabeth Novena.
Well, more border updates. Countries or regions will be classified in one of 4 categories, each with differentiated measures premised on a traveller's 21-day travel history prior to their entry.
Travellers from places in Category 1 can enter Singapore without having to serve an SHN. They'll only be subject to a PCR test on arrival, and if a negative, they can proceed with their activities. Except for Jiangsu Province, mainland China is in this category, along with New Zealand and Taiwan today. Hong Kong and Macau will be added from tomorrow.
Travellers under Category 2 will have to serve a 7-day SHN, which can be done at their accommodation of choice. Singapore citizens, PRs and long-term pass holders can serve it at home if conditions are suitable. All will also need to undergo several PCR tests on arrival as well as at the end of their SHN period.
Unvaccinated travellers from these Category 3 places will be required to undergo a 14-day SHN at dedicated facilities, while those fully vaccinated may apply to serve their SHN at a suitable accommodation of their choice. In addition to a PCR test on arrival and on the 14th day of their SHN, these travellers must administer a self-swab on days 3, 7 and 11. All other countries or regions fall under the strictest 4th category.
Well, from 11:59 p.m. tomorrow, newly arrived travellers who have been fully vaccinated overseas with a WHO-recognized vaccine will be issued a tamper-proof vaccination sticker to be affixed onto their passports.
This will make them eligible for vaccination differentiated rules here. And these travellers include Singapore citizens, PRs, as well as long and short-term pass holders from all countries and regions.
Meanwhile, 29 new locally transmitted cases were confirmed today, the lowest since July 13th. 16 are linked to previous infections, while 13 are currently unlinked. More details will be released later tonight.
Separately, starting August 30th, under pilot, fully vaccinated patients with mild or no symptoms may isolate at home, spending a few days in a medical facility. This home isolation program will be for patients who require minimal care to recover at their place of residence and be given access to 24/7 telemedicine services instead.
But such patients and their household members must meet certain conditions. For instance, everyone in the house must be fully vaccinated and not belong to any vulnerable group like the elderly or immunocompromised.
They must remain in their place of residence at all times and will be tracked through electronic monitoring and surveillance checks via phone calls. Patients will be swabbed on the 9th day of illness and can be discharged if their test result is negative or if they carry a very low viral load. And all household members must undergo daily ART testing.
And with more local and global data showing that fully vaccinated COVID-19 infected individuals have a much lower risk of developing severe disease, we are now piloting a home-centric model for the management of COVID-19 patients with mild or no symptoms. These individuals require minimal supportive care and are suitable to be cared for in settings beyond the hospital or our CCFs. And this will allow the hospital's resources to be redirected to caring for those who are more frail and vulnerable to severe infection, as well as a worse outcome. As Minister has shared, home isolation is not a new concept. And there are many other countries, including Australia, Canada, Israel, the UK, the US, Thailand, who have allowed well but infected individuals to isolate at home until they recover from their infection. We are adopting a risk-calibrated and phased approach in implementing this pilot with the intent to ensure safe and effective isolation of COVID-19 infected individuals while preserving the safety of household members, neighbours and the community.
For more on today's announcements, you'll find complete coverage at straitstimes.com or tune in to Newsnight later at 9 p.m.
You can also watch the full press conference on the Straits Times' YouTube channel. Once again, I'm Haryanto Diman with Olivia Quay. Stay safe, everyone.